everyone, I am Dr. Sneha Divekar. Today is the third lecture of my sports dental care lecture series and the topic is oral care issues of athletes. Athletes are predisposed to certain oral health risk factors linked to their participation in sports. These risk factors are mainly linked to the demands of exercise and training on the human body. These risks include sugar loading during training and competitions, high volume and high intensity training that takes place which can lead to immunological deficiencies and can cause oral infections, inaccessibility to dental care, not giving priority to the oral health by the athletes and the coaches, and even the psychological makeup of the athlete. Now one has to understand that these risk factors are not just limited to showing their effects on the oral and hard and the soft tissues, but the training and the performance of the athlete can also get affected. So let us see in detail how exactly or what is the relation between sports and oral health. Now first let us see how does sports affect oral health. The first is dental injuries. As I have told in previous lectures, dental injuries are the most common seen injuries in sports, especially contact sports. Now bruxism and clenching, this is more commonly seen in athletes due to the stress that they undergo during trainings or competitions or during participation in any big events. Now bad bite or malocclusion, this can also lead to improper posture problems in the athlete. Now teeth decay. The high sugar content of the sports drinks along with that improper oral hygiene and reduced saliva, all these combine to increase it leads to the increased decay rate in the athlete's mouth. And last but not the least is teeth sensitivity. This is caused due to enamel erosion which is seen due to the acidity of isotonic or energy and sports drinks that the athlete consumes, and the teeth that come more in contact with chlorine, especially in the cases of chronic or competitive swimmers. Now similarly, let us see how does bad oral health affect the performance of the athlete. Now if the athlete is having any gum disease, it can lead to body inflammation in some other parts of the body. This can increase the chances of developing heart problems, diabetes, etc., which could worsen the athlete performance. Now if there is bad bite or bruxism or jaw clenching, what happens is in this case it can lead to overloading of the jaw muscles. This can transfer the tension to the neck and the back muscles. This can lead to spasms of the muscles of the back and indirectly affect the athlete performance. Then bacteremia, which means if there is presence of bacteria in the blood due to any oral infection if the athlete is having, it can lead to body ache, fatigue, fever, etc. Now you know that if the athlete gets fatigued easily, there is very high chance that the performance is affected. Another problem is inadequate chewing due to missing teeth or mainly, or gum problems, etc. Now because of this, what happens is there is the digestion slows down, okay, and the energy power of the athlete is reduced. And the most important thing is dental pain. We know that the dental pain can reduce the athlete performance because it is so unbearable that the athlete is not able to concentrate and reduces the focus and the strength to carry on with the game. Now this happens in case if it is chronic, if the pain is it is acute. If it is chronic, then it can affect the athlete. The athlete can get irritated, the athlete can get depressed, the athlete is not able to focus on his training and game, and the entire life of the athlete gets affected because of this dental pain. Another issue which is more common or more specific seen in the athletes is substance abuse or tobacco abuse. These habits are more commonly seen in the athletes than in the general population. Now already there is a burden of dental diseases on the athletes. Now, if the athlete is a tobacco or substance abuser, this can complicate the situation because of emotional or behavioral problems seen in the athlete, poor nutrition or oral or general health, inadequate oral hygiene, etc. So it is the duty of the parents, the coaches and the physicians to look after all these various kinds of problems, see if there are any behavioral issues in the athlete, keep a check on the oral problems and bring the athlete to the dentist whenever required. One very big factor which is hindering the oral care is giving it a priority. What we have seen, especially in a country like India, oral health is not given priority by the athletes and the coaches. Even if there are the elite athletes, even they are not well aware of their oral problems, or they are not taking care of their oral health, in spite of the fact that the rest of the body is completely fine tuned for optimal performance. That is why it is your duty as a sports physician or a sports coach or the parent of the athlete that to give priority to the oral health. So let us know now in what all oral problems should the athlete visit the dentist. Mainly in case of dental pain, dental erosion or teeth sensitivity, teeth decay, which can be in the form of the athlete can see there are black spots on the teeth, or there is food lodgement in the teeth. Then in case of teeth sensitivity or due to gum swelling, if there is bleeding while brushing, then in case of chronic ulcers, then due to erupting molars, all these reasons. Okay. Now I will give you few oral care tips for the athlete. As an athlete, you are at high risk of developing teeth decay and erosion, so you must brush twice daily and gargle at least 2 to 3 times daily with the help of a mouthwash. Then after this, it is very important that if you are going to any tournaments or matches, you have to carry an oral care kit with you. If you are having any dental issues, you must show it to the dentist. And last but not the least, you have to have a dental checkup done before you start training or before you are participating in a major event. The main two reasons for this are, first of all, you can avoid any point which can affect your oral performance due to avoidable dental treatment. And if you need a mouth guard, or if you are playing a sport which need a mouth guard, this is the right time that you have to do it. Another very important tip is you have to remain well hydrated while you are performing or while you are training or during the workout. You have to avoid acidic drinks and foods during workout, and especially if you are under 18, sports drinks are big no. And if you are an athlete who is above 18 and if you still need to have a sports drink, then you might as well sip it with the straw so that it does not touch your teeth, and you have to gargle or rinse your mouth thoroughly with water. Thus, I am sure all these tips are going to be useful for you, and I am sure that this lecture has been an eye-opener as to how sports and oral health are deeply related. So it is my request to you that please take care of your oral health. Our next lecture coming up would be a very important topic, that is emergency management of dental injuries. So now this is Dr. Sneha Divekar signing off, and please stay tuned for the next lecture. Thank you.